Good evening. It's sunset in New York City right now. I am Alan Bienstock. I'm a board-certified plastic and reconstructive surgeon. My specialty is wound care for those that are homebound and bedbound. I'm doing a new series of videos where I'm actually going to the patient's home and showing how I do the wound care and what their wound is. I want to give you an introduction to the next patient. He's an 86-year-old male with a history of dementia, as well as deterioration and diabetes. Over the past year, since August 2024, he's weakened and deteriorated. He's no longer walking. He's become bedbound and homebound. He's currently on hospice care. The wife is the primary and only caregiver. She's an amazing woman as far as taking care of him, feeding him, changing the wounds, and turning him. She's overburdened. She's managing chronic pressure ulcers. One is of the sacrum and a new one is of the right hip. In this video, you're going to see me doing a surgical debridement or sharp debridement of the right hip because there's a lot of slough. It's what we call an unstageable ulcer. There's no depth because all black and yellow tissue. I'm removing all the yellow black tissue to get it to a stage 4 pressure ulcer. I wouldn't worry about the staging right now because it gets very complicated, but I'm trying to remove all of the devitalized or non-living viable tissue, which you'll see in the video. The one on the sacrum also kind of went downhill a little bit. There's probably more pressure on it. Since the wife doesn't have caregivers to help her, she's doing all the work. It becomes very hard to keep pressure off of all of the wounds, even though he's on what's called a group 2 mattress. In the future, I would love to be able to get him a Clinitron bed or a group 3 mattress since he has multiple pressure ulcers. So right now we're trying to change wound care, get both wounds, both the sacrum, which is on the coccyx or the back over here, as well as the hip, which is over here, better. On the sacrum, we're currently doing a wet to dry dressing with Dakins, which I normally don't do, but because there's been an odor and has a little bit of an acute infection, I want to get the bacterial load down, what we call the biofilm. After that, we will switch over to doing wound care with Hydrophera Blue, which is a great dressing for cleaning up wounds because it has methylene blue as well as Gentin Violet. These are kind of old school medicines that are now embedded in a vinyl foam. For the right hip, after I do the surgical debridement, we're going to be using something called Santal or collagenous, which will help remove the additional devitalized tissue or slough, with Bienstock, which is basically a dressing that's hypertonic, meaning it has extra solvent that helps remove all that devitalized tissue. This needs to be changed on a daily basis. I'm working in conjunction with the nurse. The most important thing is we've discussed in the other videos, the 4 Ps, which you'll hear about from the wife. The wife and the family are very spiritual, so they're praying, they're giving a lot of love. But pressure relief is one of the most important things, as well as protein. The wife is doing an amazing job, but it's very challenging. She's trying to feed him around the clock, as well as giving him supplemental protein. So this is where we are right now. I've only been seeing him for the past month and a half to 2 months. I hope to get all the wounds kind of jump-started with the debridement, as well as a new wound care. Please leave comments and suggestions below. Make sure you subscribe to the channel, and please share with all your friends and colleagues. Thank you so much, and make sure you watch the next video, which shows the live session of us doing the wound care. Thank you.